All right, for those of you who don't know me, I'm Dr. DeWitt. Hi, how are you? And I work here with Dr. Bergman, and we're going to talk about natural vision correction, which is awesome. And I have personal stories that I've done these exercises, not even all of them, just some of them, and it has helped me immensely. And it's all based on a little overview first. We're going to talk about the Bates method. One of the most important things about seeing better is relaxing and not trying to see better. You have muscles around the eye that we'll go into more detail later. And when you have a lot of tension, you can't actually focus the way you're supposed to. So it's a way of focusing without stressing. So we're going to teach you how to breathe and things like that. We're going to go over some relaxation techniques, like I said, stretches and exercise. We're actually going to break this into a two-part series. So we're going to go over nutrition and chiropractic and how it applies to vision next month, because there's so many different exercises, relaxation and whatnot, and then we're going to do a little summary later. A little bit about William Bates. He was an ophthalmologist back in the 1800s. This was out in New York, and revolutionary guy. People loved him. He had super happy patients. He was prescribing, glasses, contact. I don't know if they had contacts back then, but glasses, and just was trying to fix them the old school way. And for whatever reason, nobody knows, he decided, I think there's a better way. So he decided to start giving exercises to his patients, and they started getting so much better without the glasses. And he said, I think the glasses are kind of like a crutch, and it keeps the eyes from actually being dynamic the way they're supposed to be and being able to focus like they need to. So he started doing these exercises and came out with this Bates technique. And some of his students actually got in some serious trouble back in the 40s and 70s. Margaret Corbett, she actually went to court twice for practicing medicine without a license. And if you know anything about chiropractic, that's kind of something that we had to experience in the early stages too. But luckily, that all got dismissed, and so she got out no problem. And then M.H. McKay was a PhD that did his dissertation in 1978 on the Vision Training Institute. And he found some really good results, especially in older individuals, that they thought, oh, it's old age, you're not going to be able to see. I don't mean to look at you, Gary, I'm sorry. But they thought it was just old, they just thought it was old age, and that was why you would actually start to lose your vision. And he found 3 different individuals in this study, in this 2-year period, that were in their 60s that started doing really well, even with the exercises, regardless of their age. So that was really enticing and exciting. But more importantly for me, I like The Brave New World. Anybody read that book, The Brave New World? Yeah, that individual, when he was younger, for 18 months, he suffered from keratitis and was almost totally blind in one eye, and he could only see vague images in the other. And he actually was a student of Margaret Corbett's, which was interesting. And after training with her, he went on to write his own book all about vision, because he was just amazed. He said without glasses, he called them spectacles back then, but without spectacles, he could read at least twice as well as he did when he wore his glasses before, after doing these techniques. And that's just a little part of what we're going to talk about. And then, of course, you have the American Academy of Ophthalmology in 2004 and the Christchurch Hospital in New Zealand in 2005 that said, oh, it doesn't work, this is crazy. But I'm here to tell you personally, I've done it myself, so I know it does work. So take it for what you want. So now me, I've worn glasses since the 8th grade. When I was in the 2nd or 3rd grade, I used to think that people that wore glasses were really smart. And so I was like, I want to look smart. And so I want to wear glasses. My mom and dad were like, no, just slow down. You'll get your glasses probably eventually. I also wanted braces too, but they didn't go for that either. So I don't know, I just liked them. But so I always wanted glasses, and then it wasn't until the 8th grade that they said, okay, I think you need glasses. And unfortunately, I don't have, well, actually, fortunately, I don't have a picture of me wearing those glasses, because they were huge, big, covered my whole face glasses back in the 80s. And I thought it was great, didn't think there was anything wrong with it. And I started wearing them, but then when I was playing football, I started playing football a lot in the 9th and 10th grade, and you can't really wear those glasses, and you don't want to get those goggles. It looks kind of funny. And so I wore contacts, and it was miserable, because I'm the kind of guy that always touches his face, and so I was always like touching my eyes and trying to make sure the contacts were in the right place, and I had to use the solution and all that stuff, and it was just a nightmare. So I said, there has to be a better way. And ironically, of course, once I learned these exercises, I didn't need my glasses anymore, but I wasn't playing football anymore, because it was like 2 years ago. So, what are you going to do? So here we go. Halloween's coming up, so we got a cool little eyeball picture. So we have the 6 different muscles of the eye. And the reason that we're showing you this is because and we're going to have a slide next that's going to show you exactly how vision works. So as we know, you have the lens that the light comes in through the lens, and then it focuses it on the back of the eye on the retina. And if it's good vision, then it's going to be right there on the retina, in the fovea centralis is the focal point. But if the eyeball is a different shape, if it's too long and it focuses in front of it, then you're going to be nearsighted. And if it focuses behind where the retina is because it's too tight and it's narrow like this, so it focuses it behind where the retina would be, then that's farsightedness. And so it's all about the tension. So that's like I was talking about before with tension. If you have any kind of like the oblique muscle that pulls the eye down or it pulls it out and up, then that's going to change the shape of the eyeball itself. So that's what we're focusing on with these exercises, is the actual changing the shape of the eyeball so we can make sure the retina and the screen, so to speak, that everything is focusing on is at the right distance from the lens. And this is what I was just talking about. So you see here, normal, it focuses directly on the fovea centralis here. If it's farsighted, it's focusing it behind the eyeball itself, behind the retina, so that means that it's squished, for lack of a better word, it's squished this way. And then if it's too long, because the other muscles are pulling it in different directions, then you're going to be nearsighted and it's going to be focused here in front of where it should be focused on. And these exercises are going to show us how to relax those muscles and fix that problem. Now there's a lot of stuff going on in this little cartoon we have here, but I know the majority of you are patients already, and we do a lot of the work on the cranial bones. And when you work on the back right here, that's where the visual center is, and you can see this right back here, the visual cortex. So you have the vision comes in, goes to the retina here, goes down to the optic nerve, and then it comes around and gets processed by the visual cortex. So if you have pressure back here on the occiput, the back of the skull, or anywhere along those ridges where the bones fuse, then that's going to affect the circulation to this area. And of course, that's going to affect your vision. And that's not good. But we're not talking about chiropractic this time. Next time, we're going to get more specific. So now, tension is the main cause, as I said. So now we're going to focus on breathing. Now patients of the office are going to know how to breathe. But when you take a deep breath in, you're going to put your hand on your belly. So everybody put your hand on your belly. And when you take a deep breath in through the nose. The belly should go out. Your shoulders shouldn't go up. And then out through your mouth. Okay? No yawning. So then that's how we breathe as children. It's diaphragmatic breathing. So you breathe in, belly goes out. It doesn't look very good, but that's okay. Some of us show a little more than others. And then breathe out through the mouth. So it's in, belly goes out through the mouth. And if you do this for 3 or 4 minutes before you start any of these exercises, it's going to help the results immensely because you have to make sure you're nice and relaxed. Now stretches as well are also important. So what you can do is you can just tilt your head to the side like this, and you can feel the stretch on this side, and you can go the other side, and if you feel any pops or anything, that's fine. That's just pressure releasing. And then you can go back like that. And then you can also grab your hands like this in the front and just kind of go around, and don't hit anybody in front of you. Go around in a circle like that a few times. That helps loosen up the upper extremities and the shoulders. And then you go the other direction. So the whole point of this, and you're always breathing while you're doing that, in through the nose and out through the mouth. So that helps get you nice and relaxed so that you don't want any tension in the neck when you're trying to do these exercises. And now the first one actually is called the sway. And what you do is you're focused on an object there, and you kind of lean one side and lean the other side. And you notice that when you lean this way, the objects you're looking at are going to move the opposite way. So when I lean to the left, it looks like the camera is moving to the right. And when I lean to the right, it looks like it's moving to the left. And if you hold your thumb up and do that as well, it's even more obvious because when it's closer to your eyes, it makes it more obvious which direction it's moving. So it's counter to the direction that you're moving. And so that helps your brain to process it better. And on a more advanced note, we're going to do what we call the long swing. So you're standing here just like this, and then you turn this way, and you relax the whole time, turn this way. And we'll do a workshop next time so everybody can do this, but I'm just demonstrating. So it's amazing. And you turn this way, and you're just like that. And you're just relaxed and just letting everything go by. You're not trying to focus on anything in particular. And that is one of the really fun ones. The next one's my favorite, though. the cross crawl. And we've talked about this in the office as well, because whenever you use a cross crawl mechanism, when you're doing the shoulder exercises like this, it's the cross crawl mechanism. When you do the knees, you're doing the feet alternating sides, and that works on the brain and helps to stimulate it so that it's going to heal faster. So with this, you're looking straight ahead, and you can bring a hand down. You have to make sure you haven't had any adult beverages when you do this. And it's just like that, deep breathing. And I'm wearing boots too. And so you just do that deep breathing and incorporate the motion, and the more you can stimulate the brain while you're doing the deep breathing and the motion, the more it's going to help the eyes to work better. And so another thing we're going to talk about later is called the lazy 8. And so what you can do is you do this exercise, and then you trace the infinity sign, so it's like an 8 on its side like this, with your nose. And I can't do that very well right now, but that's a good one too. And so then the next thing is going to be, this is another really great way to get more oxygen to the brain, because as we spoke about earlier with the circulation and the visual cortex in the back of the brain, you need to make sure you're getting plenty of oxygen there. So we did the stretches, and make sure that when you do the stretches in the neck, you don't want to go in a circle, because that does the coupling motion, and there's a lot of points where you can have damage and injure your neck when you do that. So you don't want to do the circles like they used to back in the day. We used to do that with football too, but obviously it was not right. But so now we just do it side to side and back like that. So yawning, why is yawning important? When you yawn, it's contagious for one thing, but it really forces a lot of oxygen into the brain and into the bloodstream, and that's excellent for vision. Now this is one of the basics of the Bates method. It's called palming. So what you would do is you would be sitting like in this chair, and you want to make sure your elbows are supported. You put one hand, your right hand, over the right eye, and put the palm of your hand is right on the cheekbone. You're not pressing on the eyeball, and then you do the left hand like this. And as it shows in the picture, you want to make sure you have your elbows supported like by a pillow or on a table or something like this. You do the deep breathing. In through the nose, out through the mouth. And you have your eyes closed while you're doing this. And at first, you're going to have all kinds of thoughts running through your mind. This is sort of a meditation, which is really, really a good thing, because you're trying to relax the mind, relax the body. So you're breathing in. Try not to hyperventilate. And you're going to see complete blackness. At first, you're going to see different colors and things like that as the rods and cones in your eyes. Those are the cells, specialized cells that pick up picture or images. So the cones do the color and the rods do the black and white. And so you just want to see all black. And if you can visualize black objects like a black piano or a black cat, anything black, doing the breathing, focusing on the black. You can do this, the record, I believe, Dr. Bates had someone did this for 20 hours straight. 20 hours straight, and he had been legally blind before he did this. Did it for 20 hours and was able to see fine after that for, I think, 4 years without having to do it again. I mean, it's crazy. There's all kinds of cases like this. That's why, regardless of what all the other organized people say, oh, it doesn't work, I'm here to tell you it works. Now the next one is even better, because palming, you're focusing on the darkness. Any questions on the palming? No? Okay. You're focusing on the darkness and the total blackness with your eyes closed, nice and relaxed. But the next one is just the opposite. So this is the top secret exercise that I did, sunning. What you do with the sunning, there's a couple of different ways. You can sit there with your eyes closed and say the sun's here. They also have something called skying, where you're looking away from the sun, so in case you want to gradually work your way up. Because we are so used to wearing sunglasses that it doesn't give our eyes the ability to react and focus the way they're supposed to. Plus, when you focus on a computer monitor for a long period of time, the little ciliary muscles that bend that lens, they get really, really tired, and so it makes it harder for us to focus long distance. And so it's the people that work outside and out in the fields, or just work outside in general, they're changing their focus. They're shifting from something near to something far, which is another completely different exercise the Bates method teaches. And that actually helps keep the placidity of the ciliary muscles of the lens, so it can help make sure that you're able to adapt whenever you're reading up close or when you're far away. And I'll talk about shifting right now too before I go into sunning. So with shifting, you know, earlier with the swing back and forth, we were doing the thumb here and going back and forth like so. What you do now, you have your thumb up, like I'm looking here, and there's a car there, and then even further is the other building. And so I can focus on the thumb at first, and then I can shift my vision and focus further away, and then I can focus even further. And you notice as you shift where you focus, everything else gets blurry. So I'm looking at my thumb here, and it's nice and clear, and then I look at the car, and it's almost like my thumb disappears. And then I look even further, and it's like everything else gets blurry too. So that's because whatever you focus on, that's what gets the clearest. And you can even take it down to a smaller level where if you have a letter, we're going to have a Snellen chart, which is all the letters like you test your vision. When you have a big letter in front of you, you don't just focus on the whole letter, because the fovea centralis, where you focus things on the retina, is really, really small. And so you focus on different parts of that letter instead of the whole letter. So say there was a big E here, you'd focus on one little corner here, and then you shift over here, and then shift down here, and eventually you're going to be able to see clearer instead of trying to see all of it all at once, because it's always going to be, man down, we're okay. But it's always going to be a little fuzzy until you train your eyes and the muscles of your eyes to be able to relax and just take it all in without trying. And if your eyes ever get dry and you start to get a headache because you're staring at the computer screen all day, sit there and just take a minute, do the deep breathing, and blink. When you blink, your tears form a contact lens naturally over your eye, and that'll help flush out the toxins, and that helps you to relax and helps you actually to see better. I know, it's true. So back to the sunning. So sunning, you can stand with the sun right here. You're looking at the sun, and then you just turn this way, and you can feel the warmth of the sun, because that helps increase the circulation, the warmth, and you'll feel it cooler on the opposite side. So you can turn this way, and then slowly turn this way, and you're always doing the breathing. And then, like in the picture, you can look at the sun, and instead of moving side to side, you can do your hands. Even doing this with the lights right now, it gives like a strobe light effect. And you can even go, this way, you can go this way, and that helps to stimulate those specialized cones in the back, rods and cones in the back of the retina there. And it's amazing. This is what I did. I did a little more advanced where you actually have your eyes open. And people were like, you're going to burn your retinas, but it's actually, it was fine. I was staring at the sun. I probably looked a little crazy. I was like this because it was really, really bright. And I just was doing like this, and that really helped a lot. I did that for 30 seconds, and I didn't need my glasses for 2.5 years. Wow. And I mean, it was, I still can't believe it. But so it was worth the little struggle for, 10, 15, whatever seconds. I'm just like, oh, okay, it hurts, okay. And then I was like, okay. But the thing is, whenever you do that, you have to go from the sunning to the palming again, because you go from the light to the dark, and that helps to really train those muscles to work the best they can. So now I've got a really cool way for everyone to tell. How many people would like to know if somebody's lying to them? Nice. I know, but I don't want to tell you I know. So now this relates to different way where the eyes move and what's going on in the person's brain. So if you ask somebody a question, and FBI interrogators do this all the time, if the person looks up and to the right, they're called micro expressions. If they look up and to the right just for a second, or if they are up there looking like, oh, I don't know, they're actually trying to remember something. But if they look up and to the left, it means they're constructing a story in their mind. Yeah, as they're looking at you. So if they're looking up and to your right, their left, you know what I mean? If they're looking that way, it's bad. And if they look up when they're talking to you, that means you don't smell very good. That's not good. So now we're going to talk about the lazy 8s next. That was another one. It's called tracing. So you trace it with your nose. And so as you're looking at the symbol, you go like this with your nose. You go up and down one way. And you're doing the deep breathing. And you would actually have that image. I can't look at it, but I'm acting like I am. I have eyes in the back of my head. I train so hard. And so you just do like that, and then you can also keep the head still and just do it with the eyes up and around. And just notice how every little part that you're looking at becomes clearer and the rest of it gets a little bit fuzzy. It's just being more the awareness of how your eyes work. And when it is really a pinpoint area, it's so much clearer than if you're trying to see the whole image. Okay, now this is the Snellen chart. Ta-da! So what you would do, how far, let's see, who's brave and wants to try to read this?
I'm going to get a test soon. I'd like to try it.
You would like 0 and 10? What are you going to do?
I need to get a test.
Okay, well here, stand right here. What's your name?
Maya.
Maya? Dr. DeWitt, nice to see you. Shh, she's going to test.
I'm getting old now, so I have to.
You're not getting old? No, listen to you. Okay, now cover one eye.
Oh.
Yeah, we're going to see which eye. Well, this is the way you tell which eye is more dominant. Now, what's the lowest line you can read?
Next to the bottom is LEFGD FGT.
You only missed 3. 3 out of 8. Now switch to the other side.
Oh, now I have to go up a line.
I have to go up a line. Ah, so your left eye is dominant. Okay, go ahead.
FBD.
Wait, which line are you reading?
Obviously, I'm getting.
No, is it the one right below the green line or above the red line?
It was right below the green, but let me try the green now that you said that.
Above the green? Okay, no, it's all right.
EDFCZP.
That's excellent. And so now what I'm going to have you do is focus on the E, both eyes open.
Okay.
Focus just up on the left side of the E, the left little corner there, and then shift down to the bottom right corner.
How far? Oh,
all the way to the bottom right corner, yeah. And then up to the upper right side, and then down to the lower left side, and then go back up to the upper left corner, then down to the middle, and just pick random spots on the E and just look all around it. Make sure you're breathing. In through the nose, out through the mouth. There you go. Do that a couple more times. You're a very quiet breather. She was breathing. Well, that's good. She'll pass out if she's not breathing. Okay, now you're going to close your eyes. Do the sunning for a second. The palming. Well, my hands are so bright, it's like sunning. So you're going to put your hands like this and do the deep breathing for 3 breaths. Okay, now cover your right eye. Open your left and try to read the line below.
Oh, I'm going to read the red line.
Oh, good.
DEFPOTEC.
Perfect. See, and I didn't pay you for that.
Really?
Thank you. Thank you very much.
Goodness,
that was very good.
Pass my test.
I know. See? See? So it's all about relaxing, especially when you're doing a driver's test. You don't want to be stressed out because you're like, I have to pass or I'm not going to have my license. Just try to do the deep breathing and that palming. You can do sunning too outside the DMV. People wonder what you're doing. So this next one is, especially if you're doing this one, they'll be like, what did that guy take? I don't know about that.
I'll give you a white bird.
All right, this is a really neat one too, and we're going to have this set up next week or next month. All right, this is one of the neatest things ever. You take a string, it can be 5 feet long, 6 feet long, 10 feet long, and put a bead every 6 inches, and you hold it at the level of your nose, and it literally, when you look at the very first bead, because it's based on the binocular ability of your eyes to focus, you look at the first bead, and it's kind of like this one. When you focus on your thumb, you can see the thumb really clearly, but further away is all blurry. When you look at this, it sees that, but then it looks like the string splits in 2. And then you can skip around and go to the next bead, and it looks like an X. And this is one of the freakiest things it's crazy. And you can actually feel the muscles of your eye straining to make this happen, but it's so helpful. And then if you look at the very last bead, it's going to look like an A without the little cross part.
A TP.
Or a TP. That works. That works too. And that is what is so, I mean, it's just amazing because, like I said, you hold it up to your nose and you're thinking, oh, whatever, this is silly. But then when you actually do that, you're like, wow, this stuff really works. And it's kind of like the palming and the sunning, they're so simple, you're just kind of like, oh, okay, you don't think, but obviously, she has shown that it does work. But with the bead, it's really interesting because of the way you can focus, and you almost get like an eyeball cramp as you're trying to jump from bead to bead, and you can feel the muscles going, wait, what are you doing? I'm not used to moving like this. Because they're so used to sitting in front of a computer screen and just kind of zoning out for 8 hours. So that's really important when you're sitting at a computer. We have the neck curve exercise that you can do. I'm going to walk on over here and show people that don't have this yet, and there is a video on the YouTube channel on how to use this. And this will help take pressure off the base of the neck as well, and we'll go into the chiropractic stuff next month as well. So you just rest your arms just like this, and you do your chin up, and then straight ahead, and then you can just relax just a little. That's a little more advanced. If you just want to keep that pressure right there, you just go like this. That helps increase that curve in your spine, especially in the cervical spine there, and that's going to help get that head directly over the shoulders. And that's going to help have more relaxation in those muscles, because if you have tension on the brachial plexus that comes out of the base of the neck here, that's going to cause numbness, tingling in the shoulders and the fingers, all kinds of upper extremity problems, but that's also going to affect your vision. All right, now I also wanted to say, as a thank you, I'm not quite done yet, but as a thank you, everyone's going to get a copy of my latest book. You don't need glasses or contacts. It is available on Amazon.com right now. So, vision and nutrition, what you eat can help or hurt you. And those are blueberries, in case no one knew. They're usually not that big. If they were, that would be even better. So a quick review, these are the muscles of the eye, and with the exercises last time, which was a couple of weekends ago, or a couple of weeks ago, we actually talked about how to work on the strengthening of the muscles, but you also have to learn how to relax them so they can change the shape of the eyeball itself to help make sure that the focal point is actually where it needs to be. So if you're farsighted or nearsighted, it'll kind of adjust appropriately. So that is the reason that we're doing the exercises, and I'm going to go over just a couple of those real quick just to review. Now the part of the relaxation, really big part, is the belly breathing, and I like to show off the belly on this one. So remember, when you breathe in through the nose, the belly should go out and out through the mouth. This is how we breathe when we were little babies, because we just naturally knew how to do that, and that's why babies are so cute. You always want to poke them in the belly because their bellies are always going out like that. So it's in through the nose, out through the mouth, and that really helps to hyperoxygenate the blood, and that's always good for better vision. Now the palming, this is normally done seated, but I demonstrate like so. You have the heels of your hands on the cheekbones, the fingers crossed across the forehead like so, and you do the belly breathing, so it's in through the nose, out through the mouth, and you just focus on darkness. And this is going to really help to stimulate the rods in the eyes. Those are the ones that see low light and black and white, so in through the nose, out through the mouth. And that really helps to focus on the relaxation. And this next one is my absolute favorite. This is the one that I did one time and was able to get rid of my glasses for 2.5 years. Yep. So what this does is, as opposed to stimulating the rods that do the low-level black and white light, this stimulates the cones, which does the color. And so what I did, even though it's a little more advanced, I didn't realize at the time, and it was kind of funny watching me, I was actually standing outside of a Whole Foods, true story, and I look up at the sun, and it's like super bright. It was the middle of the day, and I did my hands like this, and that creates a strobe light effect that stimulates the cells and really helps to rejuvenate vision a lot. It was amazing. And then I found out, and I only did that for about 3 sets of 10 to 15 seconds each. And it was amazing. I mean, you see spots for a while because you're staring at the sun. They always say don't stare at the sun, you're going to burn your retinas. And Dr. Bates, that actually originally came up with this method, he and his students got taken to court saying they were going to burn people's retinas and things like that. And he had all kinds of clients, celebrity clients back in the 1900s that said, I'm fine, I don't have any burned retinas. And they did the studies and all the retinas were fine. So all those got dismissed. So a lot of times the people that are blazing a path through the frontier of new opportunities, new chances for a new way of thinking, they get criticized at first, and chiropractic was the same way. So now we're going to talk about 3 of the main conditions that people worry about. Glaucoma, that's an increase in the pressure of the eyeball itself, and when you have increased pressure in the eyeball, it actually starts to put pressure on that optic nerve, and this is going to cause permanent loss of vision, which is really bad, but we actually have foods that will help to relieve that pressure in the eyeball. So if you have any kind of glaucoma or know anyone with glaucoma, really important that you pay attention to that. And I'm also going to give you a downloadable list of all the foods, so it's going to show you what goes with what. So just in case you were wondering. And this is another big one, age-related macular degeneration. Now, of course, they don't really know what causes this. It's the macula in the back of the eyeball, in the retina, that starts to deteriorate, and you can't focus, and you start to get blurry vision, especially if you're over age 60. I'm not looking at you, Gary, but it's one of those things that I'm looking over there. I'm not looking at you.
Because you're sitting in front of me.
Exactly. But it's one of those things where it's kind of like with arthritis. People just say, oh, well, that's part of old age. Well, no, that's not how it has to be. As patients here know, that if you do the proper nutrition, have the proper hydration, get the proper motion in those particular joints, and especially nutrition with the eyeballs, because there's not a joint involved technically, then you're actually going to heal that tissue, and it's going to constantly regenerate. And as you know, your blood is recycled every 120 days, so you have brand new blood cells in there. So in the skeleton, it's 12 to 18 months, you get a brand new skeleton. So if you make sure your bones are aligned properly, then you're not going to have as much arthritis, and eventually the body starts to resorb that. I always thought that was kind of neat. And this is also called ARMD. We're going to abbreviate it later, so that's a mouthful, age-related macular degeneration. Now, cataracts. Now, this is the most common thing over the age 40. It's another one that they're not exactly sure what causes it. It's in the lens of the eye itself. Now, you've got proteins in there, and sometimes it starts off in a really small area, and then it can grow, and that's when you see people, it's kind of has a cloudy look in their eye, and that's a really big cause of blindness, which is really, really bad, obviously. But it's another issue of if you have the proper nutrition, proper hydration, and the muscles of the eye aren't causing a lot of strain on the lens, it's going to help to reduce that. And if you already have cataracts, there's some other foods in here that will help to reduce that and help to clear up that lens, which is hard to believe, I know, but true. Working with the body, that's the secret. Now, everybody thinks carrots. Carrots are always great. So I always thought rabbits must be able to see really well because they eat carrots all day long. But what it is, it's the beta carotene in those carrots and there's a poster back there that you can actually see when you cut a carrot, a cross section, you can look at it and it looks almost like an eyeball. And what it is the beta carotene helps act as an antioxidant and actually helps with night vision as well as maintaining the health of the retina itself. So carrots, very good. Eggs. Yep. If you're juicing, that's fine. You don't have to eat it. Anytime you get the contents of the carrot into your system, that's good. Juicing, it'll be even more concentrated, so it's good. But it actually is a problem if you eat too many carrots. I've seen this in one case. If you eat carrots all day long, your skin starts to get an orangish tint. So cut back if you start to turn orange. The eggs are really great. They contain lutein, zeaxanthin, zinc, and vitamin D. And that helps to fight off the cataracts and the age-related macular degeneration. So right there, eggs is good. And they always talk about, especially in California, oh, you need to have egg whites, don't eat the yolk because of the cholesterol and all that. So it's not true. The cholesterol, that's where all the good nutrients are. And that's where all these great ingredients and these great vitamins and minerals are, is in the egg yolk itself.
Does it matter if it's cooked or raw?
No, doesn't matter.
Okay.
I was like, who said that?
I did.
Oh. I mean, if you fry it, it's going to reduce the nutrients a little bit, but you don't want to eat it raw because sometimes they're not the healthiest. And you don't want to do a Rocky where you're chugging down a dozen raw eggs because it can be a little rough.
In juice sometimes.
Oh yeah, you can put some in there. Yeah. Now the next one, this is the powerhouse. This is why it was the poster child for the nutrition for vision. Blueberries. Very high antioxidants and vitamin C. Now this is what you can do if you have pressure in the eyeball itself. Eat blueberries every day. Now and people always ask, well, how many blueberries? Do I have to eat like a bushel basket of blueberries? Like, no, you don't want to eat that many blueberries. The important thing with this is you can eat consistently blueberries every single day, even if it's just a handful every day. So throw that in your juice, throw it in your little smoothie in the morning. It's amazing. I mean, this is just, blueberries are delicious too. I do this every morning in my smoothie. The next one's good too. Fatty fish. This helps to prevent dry eye. And it has the omega-3 fatty, do you have dry eye? See, more fatty fish. They have fatty fish in Canada?
Yeah, but you gotta watch the fish though.
Well, I know. Well, you don't want to get a lot of, you definitely don't want farm-raised fish at all. It has to be wild if it's salmon. You can also do mackerel, anchovies. The smaller fish are really, really high in the DHA, which is really, really good.
Yep.
And that is going to be amazing. That also helps with brain function as well. The next one's really interesting too. It's another one for cataracts. Legumes. So lentils and things like that. It is amazing, and this is a really neat stat that I found, is that countries that have high diets in lentils are significantly lower rates of cataracts. So in India, they eat a lot of lentils and a really significantly lower rate of cataracts. So make sure you eat more lentils. Got that, Alex? Okay, just check. You look confused. And this is the godsend of everybody here in the office. We always talk about coconuts, coconut milk, coconut water. The caprylic acid and the medium chain triglycerides, they act as a second source of energy for the brain. So you don't have to have the glucose all the time. You can actually use this. And it has been amazing results with Parkinson's patients and Alzheimer's patients that aren't quite processing the way they should. And you can have, they did a study where they had Alzheimer's patients draw a clock before the treatment, and they would draw just kind of a couple of squiggles, and you could tell they didn't have a clue. They couldn't remember what a clock looked like. But then after only a week of, I think it was 3 to 6 tablespoons of coconut oil, they were able to draw a circle and numbers, and it was obviously a clock. So there were obviously some connections that were being made there after the medium chain triglycerides with the coconut milk was incorporated in. So, I mean, why not always be that way? You want to be on top of your game, have your brain firing on all cylinders, so to speak. So make sure you incorporate your coconut milk as well as coconut oil, coconut water. Coconut water is amazing because of the electrolytes. So if you're drinking a lot of water, because we always encourage you to drink at least half your body weight in ounces of water, then you might get your electrolytes a little diluted. So if you drink coconut water, that actually has the electrolytes in them, so you don't have to worry about diluting your electrolytes out.
But this is raw coconut, right? Not the stuff, you know, they have the coconut.
You just get a young Thai coconut, crack it open. We have a great video on the YouTube channel how to open up a coconut. Yeah. You can't get that? I bet you could get it shipped.
By the time it gets there, it's not good.
The internet's amazing. I bet you could get it, even in Winnipeg. Yeah. Tomatoes. We always know tomatoes are really good because of the lycopene. Any bright colored vegetables and fruits are always good for you, because the bright color is always a healthy nutrient of some sort. It reduces the light damage of the retina. So especially here in Southern California, if you've been out in the sun a lot, you're getting your vitamin D, which is really good. It's been so hot lately that you might have a little retina damage just from being in the sun, because even if you have your eyes closed, those ultraviolet rays are going to get through into the retina. So make sure you're eating your tomatoes, and it's also good for prostate health, lycopene is. So that's why you always find that in all the men's health formulas over in Centrum and all those different places. This next one's kind of neat too. Yes, ma'am.
I heard that tomatoes, in regards to prostate,
Yeah.
were better if they were cooked
Really?
rather than raw.
I have not heard that, but that's good to know. So,
I did hear.
did you hear that as well?
Tomatoes cooked, the nutrients are more bioavailable
Okay.
for the body.
Okay.
And carrots. Those are the two.
So steam them or cook them however you like.
Yeah.
Very nice. Good to know. So cook your tomatoes and carrots. Pistachios. Another one with the zeaxanthin and lutein. What was the other one that had both of those? Eggs. Zeaxanthin and lutein. So that also fights the age-related macular degeneration. So losing your vision because you're getting older, get you an omelet with some pistachios in there and you'll be good. I'm just kidding. You don't want to eat that. That would be a little rough. Be a little rough. Pistachios are good though. This one's kind of surprising. Dark chocolate. There you go. But we always knew that dark chocolate was good for you because it's got that increased level of the cacao in there, or the cocoa, and that helps a lot with antioxidants, increases the blood flow. Also, spicy peppers are good for blood flow as well. And that's going to help to make sure you keep all those arteries going to the eye healthy and get the oxygen to the eye to make sure it doesn't start to break down. That's really important for the macular degeneration as well. And the next one, everybody's going to love this one too. I love this one. Tea and coffee. So it helps everything. Dry eyes, cataracts, macular degeneration. Maybe if you threw some blueberries in there, it would help with that intraocular pressure for the glaucoma. But this is really, really good. And I actually read that if you drink 3 cups of tea or coffee every day, no more than 3, 3 is the magic number, that it actually helps your brain to stay less foggy. So it's going to help your vision, and it's also going to help your brain to function better. Yeah, it's the caffeine. Yeah, the caffeine increases the circulation. So, and once I'm done with these, I actually have a neat little, if you were here last time, we're going to break out the string and practice the focusing. I'm going to tape it up to the wall over here, but that's going to be in just a minute. So these are the 10 foods that we've covered so far. Carrots, eggs. Carrots, don't forget, cook the carrots. Thank you very much. Blueberries, the superfood. Am I in the way? Fatty fish, but not the farm-raised salmon. You don't want farm salmon, wild always. Legumes helps a lot with the cataracts, so lentils, things like that. Coconut is the miracle nut, even though it's not a nut. Tomatoes, cook those as well for the lycopene and sun damage. Pistachios, excellent. Just don't put them in the eggs. That's got the zeaxanthin and the lutein. The dark chocolate, which is delicious and filled with antioxidants, it's going to help with the circulation to the eyeball itself. And tea and coffee. So now this is going to go over each individual benefit. Carrots, retina health, and night vision. You can't technically see in the pitch dark, but it helps with night vision so you don't get that aura around lights and things like that. Eggs fights cataracts and macular degeneration. Armed. Blueberries help decrease the eye pressure, so that is good to help glaucoma. So if you do have increased eye pressure, I know somebody was here last week or last time that had increased intraocular pressure. I don't know if they're here today though. It wasn't you, was it? No. Yep. Blueberries. So if he's watching, blueberries. Fatty fish are good for dry eyes. The legumes are good for the cataracts and the macular degeneration as well. Coconut's good for brain function and just overall circulation and brain fog, and that's all going to help with vision as well. The tomatoes for the light damage of the retina. Pistachios for armed, fight the armed. Dark chocolate, that helps with low light vision. It helps increase circulation, as I talked about before. And tea and coffee, that fights cataracts, armed, and dry eyes. Now this was only 10 of the foods. We can actually, if you want to download this list plus a few other foods, you can go to drjohndewitt.com/20foods, and that will give you a complete PDF thing that you can print out, and it'll have all the the beneficial effects. That's the good thing about food. They're not side effects, they're beneficial effects of those particular foods. And this is actually a book that's available on Amazon right now. I tried to get copies for everybody today, but I couldn't get them shipped out soon enough. I apologize for that. Okay, so chiropractic-wise, there's a study that was done with an ophthalmologist and a chiropractor that talks about these arteries here. They go down, this is the neck obviously going this way, and so these are going to be threaded through these little holes. You have holes in the side here in the cervical spine, and so when you get a cervical adjustment, that takes the pressure off these arteries and increases the circulation to the brain, and that has actually been shown to help improve vision. So cervical adjustments, I know sometimes people get a little worried. They think, oh, I don't like the cracking in my neck, it hurts and that kind of stuff. It's actually not the bones cracking, it's just a carbon dioxide bubble forming in that synovial fluid of the joints, and they're called zygapophyseal joints. Don't worry about all that. But that pressure taken off, increasing that circulation, that's really important that you do that because that's going to help your vision, among a million other things. Numbness, tingling in the arms. You know, I know we're not chasing symptoms, but we're trying to get you at optimal state, and that's going to really help immensely. That is also what the cervical curve is for, or the curve corrector, I like to call it. I know I demonstrated this before. Everybody here has probably seen it a million times, but you just go like this. You can even do this with a towel at home or something like that. Just rest your arms like this. Chin goes up, chin goes down, and you can relax the pressure, and then just let your arms rest, just like that. And that helps, especially if you have a reverse curve in the neck. That's going to help heal the ligament back here, because this is how the head should be. If you have forward head carriage, the ligament that goes from here all the way down to here is going to be damaged, allowing that to go forward like that. But when you do that curve like that, that pumping action helps force fluid in here. That's going to help heal that ligament, and that's going to get that head back over the shoulder. That's going to take the pressure off here. That's going to help better circulation to the brain, better vision, and you're not going to get nearly as many headaches or symptoms in the arms, upper extremity numbness, tingling, and things like that. So now I'm going to demonstrate how this works. This is to train we have binocular vision, so you have two eyes that go out like this, obviously, and they're more towards the front so that we can focus this way. They're not on the sides. You'll notice chameleons have eyes like on the sides of their heads, but they move independently so they can see all around. But with us, we're more focused this way. And so what you do, I'm going to stick this to the wall over here, and you can try this yourself. You're going to have it on the wall here. You put it right on the end of your nose, and it looks kind of funny, but you focus on the front bead, and that makes it look like there's a V going out, and then you focus on the second bead, and that makes it look like an X. I know this looks really silly right now, but when you do it, you're going to notice it's really kind of neat. And then you focus and you work your way down from each bead, kind of going back and forth, and that's going to show you where you can have some insufficiencies in your vision and some of the muscles you need to focus on strengthening or relaxing to help with that. So I'm going to stick this up here right now, and don't forget, if you want to download your list, it's right there. Also, I wanted to say, our cruise, we have a cruise, and everybody always makes fun of me because of my giant watch, but I got this on the cruise last year, and it was so much fun, really educational. We had over 16 hours of teaching with Dr. Bergman, and we had Dr. Porcella and some other people that did some really great instructional things while we were at sea. And this year we're actually going to the Western Caribbean. We're going to go to Haiti, Jamaica, I believe, Mexico, and there's one other one, I can't remember what it is. But that's going to be in February of next year, and the deposits are due next month. So you can go to owners-guide.com/cruise2016, and you can, if you're on the Facebook page, you can get the link there as well. And if anybody wants to go, it's going to be lots and lots of fun. All right, chiropractic care for clearer vision. Yes, we're going to do a quick review. We're going to talk about the 3 top exercises from a couple months ago, and then the 3 top foods.
So this is a combination of both those classes?
It's a combination. This is the 3rd of 3.
Oh, there's a 3rd one.
So this is the 3rd one. Quick review. So really important, we talked about the Bates method, and relaxation is really, really important. He was an ophthalmologist back in the late 1800s that prescribed glasses just like everybody else did back then, but then he realized there should have been a better way, because if you worked with the muscles of the eye, you can actually help change the shape of the eyeball, and that will help you determine how you focus. Great success, still a little controversial. So deep breathing is a big part of this. So you sit quietly, you can lay on your back as well. Put your hand on your belly, take a deep breath in through your nose, and the belly should go out. People don't like that nowadays because they think it makes them look fat, but we're trying to be healthy here. And if you're already a little chubby, then it's fine, you can't even notice. So you sit here like this, breathe in, the hand goes out, and then out through the mouth. And you breathe out about twice as long as you breathe in. So if you breathe in for 2, out for 4. And that really helps to superoxygenate the blood, and it uses the lower portions of the lungs to make sure you're using as much of your lung capacity as possible, and that gets more oxygen into the brain, which is always important for health. And one of the neat things here is you can also see the hands up here, they're like this. So as you're breathing in, you have the hands cupped in your lap, and then as you breathe out, you flatten them out, and you visualize your eyeball actually kind of flexing like that. And it's kind of a weird mind-eye connection, but you're breathing in, out, and it's really interesting because it talks a lot about that, the mind's eye, and how you need to connect your vision to your brain, which is always important because the brain is what processes it. Now, palming. Whenever we're out and about looking at computer screens all day long, driving, staring at traffic, just all stressed out, you're usually focused, especially at the computers, you're focused right here. So there's a lot of nearsighted people out there because they can see up close, but far away they can't see anything. So with the palming, this helps to repigment the brain, not the brain, but the eyeballs, because the eyes get bleached. The special cells in there get bleached. The rods and cones, the rods see black and white and the cones see color. And so when you're out in the sun or have bright light from a monitor or from lovely lights like this, it bleaches out those super cells in there, the specialized cells. And so you do the palming to help regenerate that. So you put the right hand up here on your right cheekbone, and you put your fingers across the forehead, left palm on the left cheekbone. You're not pressing on the eyeballs at all. It's just right on the cheekbone. Cross the fingers over in the forehead, and they talk about how this is a really important chakra right here, but I'm not going to go into the chakras right now. But you do this, have your eyes closed. You should have your elbows supported like in the image, and you just take a deep breath in again, out through the mouth. Do that a couple times. Now, if you've been looking at a computer screen for a long period of time, you're going to see like flashes of light. It's not going to be very dark. And you want to make sure that you get to a point where you're focusing on like a black piano, a black cat, really focusing on something really completely, totally dark, because that's going to help regenerate that pigment in there. It's called visual purple is the name of the pigment. So now the counterpart to palming is sunning. And this is what I did. I did this couple of years ago, probably 2.5, 3 years ago, and I wore glasses since the 8th grade and thought it made me look smart at first. Sorry if I've told you this story before, but there's some new people here in the audience from Saskatchewan. Thank you very much. And I wore glasses, thought it made me look smart, and then after a while playing football, I played football for forever it seems like, and wearing glasses or contacts was such a pain because I'm always touching my eyes, and I'd get sweat in my eyes, dirt in my eyes, fingers in my eyes, playing football, all kinds of bad stuff. And so after football, I became a chiropractor and realized that there had to be a natural solution to vision problems. I'm like, okay, I know that the current medical model is just drugging all the symptoms, and chiropractic focuses on working with the body and healing the body naturally. So I wonder if there's a way to do that for vision. And that's when I found the Dr. Bates method and was just blown away. So I did this exercise, the sunning. Now, this is how they recommend you do it. You start out, you're looking up at the sun, you have your eyes closed, you're just standing here nice and relaxed, and it's really important to have your arms and upper body stretched out and loosened up, because if you have any tension in the neck, that's going to help or cause pressure on the nerves up here, and that's not going to help you see better. So it's all about relaxed and accepting what you do see, because you might not see clearly at first. We're not telling you to, if you see something fuzzy, say it's clear, because that's not true and that's not going to work with your brain. So you can just see, okay, well, that's fuzzy, but I can see a little bit. I can make this out, or I can make this out, and just accept what you do see. Acceptance is really important. So with the sunning, you start out, you have your eyes closed, and you just turn your head to the side and do the deep breathing. Back and forth. And when you do that, even when the light's in here, you can kind of tell, you can feel when you turn your head to one side, the side facing the light has the light there, and it's a little darker on the opposite side. And especially when you have the sun right here, you can really notice a difference. Plus the warmth of the sun is right there, and this helps to stimulate the circulation, and it also helps to produce vitamin D3, which is always great for the immune system. So it's really important to get out in the sun at least 20 minutes a day. But I did a little bit more advanced technique, and that's what's shown in this picture. In the picture, he's looking up like this. He has his eyes closed, hands about 4 or 5 inches in front of his face, and doing the fingers up and down like this, and that creates a strobing effect with the light, so you're not getting as much ultraviolet light from the sun into the eyes themselves. And so you do that, and that strobe light effect, and you can go side to side as well, and people will think you're doing some weird little dance, or you're on like some weird drug or something. But so you do like that, and that helps to stimulate the cells as well. But I actually did it, and I'm sure I looked like I was completely insane. I did it with my eyes open, and so I'm looking right at the sun, and I'm just like this because it's so bright, and I'm just like that, and going, ah! And I wasn't making that noise, and I did it, and literally doing that allowed me to get rid of my glasses for 2.5 years. I mean, I was blown away, and that's why I said, okay, there's definitely something to this. I have to figure out a way to get this message out to more people to kind of explain how it works.
How many times did you do that? Just one time?
I did that one time, just that one time. I know. I don't know. I don't think I'm that special case or anything, because we've had several other patients that have had success with these exercises. And we're also going to talk about nutritional changes. So, legumes. Do you love those things? They're so good. They're so good. It's like lentils, chickpeas, that kind of stuff. They are so good for you, and it helps to slow down cataract formation. And so in countries that have diets really high in legumes, such as India, they eat a lot of lentils, there's such a low instance of cataracts that it's mind-blowing. But here, it's the #1 cause of blindness. So, and all cataracts is, and we'll talk about this in a minute, it's the protein in the lens of the eye starts to get calcified a little bit because poor circulation. And so there's a variety of ways to help prevent that. But legumes, keep in mind, legumes, very, very important for cataracts. Blueberries, these are my favorite, because they're just a super fruit, and you don't have to eat a certain amount, just make sure you eat a consistent amount, so eat like a half a cup, a handful, whatever it is, every single day. And it actually has been shown to decrease the interocular pressure in the eye itself, which can help to heal glaucoma, because glaucoma is a buildup of that pressure. So whenever you're at the optometrist, and I don't know if they do this anymore, would they blow the air in your eye? Remember how they used to do that? That was to see what the pressure was like in your eyeball, because if it's too much, it starts to pinch off that optic nerve that comes off the back of the eye and goes back to the visual cortex in the back. And that's the second, #2 cause of blindness is glaucoma. So that, I keep wanting to hit my computer, but my phone is so fancy, I'm going to put it right here. Peppers, macular degeneration. People are like, oh, I'm getting older, so I just can't see. It's age-related macular degeneration. Yeah. And the good thing with peppers is that it actually helps to increase circulation through the nitric oxide that it helps produce in the artery, so that increases the elasticity of the artery. And even if you have atherosclerosis, it actually can help reverse that process. And in the movie Forks Over Knives, I did a talk about that 2 or 3 years ago. Amazing movie, highly suggest you watch it, and it has really cool visuals on it. Shows how it actually can reverse the atherosclerosis and make the arteries nice and pliable again, and so that allows more oxygen or more blood, which leads to more oxygen, which that's going to make the macular area where you focus more healthy.
Are those hot ones, or do you can use any pepper?
These are cayenne peppers here.
But is that what you have to eat?
No, just any kind of pepper, but the spicier the better if you can handle it. They have cayenne supplements as well. We have a cayenne supplement over there. I don't see it right there, but I know it's over there. The only trick is if you have a cayenne supplement, you really have to make sure you eat something right after you take it, or it will feel like you're on fire. It feels like it's burning a hole in your throat. I've tried that. It's not good.
Bell peppers are okay too?
Bell peppers are okay, but if you can do something a little spicier, that's usually better. Yeah. So subluxation, as we all know as patients here in the office, I found the official definition. It is a spinal subluxation is when the vertebrae are misaligned with the other neighboring vertebrae, thus creating pressure on the spinal nerves. Now initially, that's just a misalignment, and that's all it is, just a spinal misalignment, but when it starts to affect the organ systems, muscles, and other joints, that is when it becomes a subluxation. So that's when it's a problem. Okay? That's the clarification there. So I have a question here, and this is pretty common sense. If you have pressure on the nerves that go to the eyes, do you think that would affect your vision? Well, of course, I know, but I'm just trying to tie this all in, tying it all in. So now, this first case, now these are a variety of different studies that I found that actually are case studies that show that chiropractic adjustments have helped people get better vision. Nice. So the first one, oculomotor palsy. Now the oculomotor nerve is the third cranial nerve. It's the one that moves the eye, the extraocular muscles that changes the shape of the eyeball itself. It actually controls the eyelid as well. And when you have a palsy like that, you're not able to move your eyes in unison, so they can't work together. And so you have people that want to go one way, want to go the other way. You can get strabismus and nystagmus, where it just goes all over the place. That's not good. That's not good. And just in case you want to know exactly where it is, so now this is where the oculomotor nerve is. I know it's kind of hard to see. Oh, it's not that hard to see actually. So that's the third cranial nerve, and the optic nerve is even closer because that's the front there where the eyes are, and they cut this little section off right here. But right there, that's the optic nerve going up. So it goes up, goes to the eyeballs right there. So glaucoma, like I was saying before, if you have increased pressure, it pinches off that nerve, and that's going to affect vision, and second leading cause of blindness, which is bad. Oculomotor palsy, once again, they show that cervical adjustments, so in the upper cervical area especially, that has led to visual improvements because degenerative changes in the cervical spine have been shown and reported with people that have visual disorders. So there you go. So there's one. That was simple. This next one's really exciting, actually. So has anyone ever heard of an Arnold-Chiari malformation? What that is when there is an issue in the brainstem. So this is obviously person facing this way, brainstem right here, cerebellum, brain up here, and the brainstem right here starts to sag down through the foramen magnum. So this is the skull, this gray area here, and it starts to sag down through the skull a little bit, and they start to have really odd symptoms. When I was in school, if there were all kinds of oddball symptoms, like they kept dropping keys and they like speech issues, things like that, and nobody could really figure out what it was, everybody would always say, oh, it's an Arnold-Chiari. It's got to be Arnold-Chiari. And a lot of times it was kind of funny. But the scary thing is, in the medical community, what they do, this is another common sense. I know we all have common sense here, so it's not going to make sense to you. But they say, okay, well, if the pressure from the skull that's putting pressure here on the brainstem, because it's oozing, for lack of a better word, down too far, is affecting the function, then what we're going to do is we're going to make that hole bigger. And that'll take the pressure off. But what do you think happens? It starts to slide down even further. I mean, it's insane. So there's great studies on chiropractic and Arnold-Chiari, because a lot of people, we've had people actually ask us specifically, can you treat Arnold-Chiari? It's really scary because it's the brainstem and the neck and all that. It's just all fear-based. Yes, we absolutely can help people with Arnold-Chiari malformations, and I hope that person that asked that question is watching. So it has been known to cause developmental defects of the skull bones, which is the foramen magnum. It's about that. Oh, I'm going to walk around here. I apologize for not having my. So this is the front of the skull. This is the bottom of the skull. That's the foramen magnum. So they just go in there, and the brain's coming down so it's like this. The brain's coming down too far, so they just cut that out even bigger. I still don't understand why they do that, but that's them.
Normal medical?
Yeah, the normal medical model. That's what they do. Evidence exists that supports the use of chiropractic care as a form of treatment for ACM, Arnold-Chiari malformations. Now, this specific case was a 20-year-old female, and she had an accident, a car accident, like 3 months earlier, and then 11 days previous to her visit, she reported that she couldn't see the faces of people. She couldn't process what people looked like, and it was freaking her out. She's like, what's going on? And so during her initial examination, she could only detect outlines of large objects and specific colors with her right eye, because her right eye was where she had some optic inflammation of the optic nerve, optic neuritis. That's another scary word for just nerve inflammation, neuritis. And if she had her left eye covered, she could not detect the presence of the eye chart. It's a Snellen eye chart. That's the big letter at the top, and then it gets smaller, smaller, smaller. So almost every angle of her gaze exhibited disorganization. So that's the oculomotor nerve that's affected, because the eyes are kind of going all over the place and kind of like a little seesaw effect with the pupils. So it's pretty common in the ACM cases. So she's obviously got a visual issue. So after each cranial correction, now whenever we get adjustments towards the end, we like to work on the coronal suture here and the sagittal suture. There's also an occipital suture right in the back, which my trusty little, it's right in this area here. And so we can feel if there's any misalignments there, and that's actually going to help work on the visual cortex, because that's right where the vision is processed. And so cranial adjustments like that have actually helped her vision. And her eye movements that were abnormal before were less saccadic, which is just moving in different directions. And there was less ocular confusion. So that's phenomenal. So went on and said that the cranial corrections were continued at the initial office visit until her eyes were moving through the cardinal fields of gaze smoothly and equally. Now the cardinal fields of gaze, that's when they hold the pen up like this and they say, okay, follow my pen, but don't move your head, and they move it side to side, up, down, and then diagonally. So that's to make sure that all your different fields of gaze are able to move smoothly. If it jerks around a little bit, that means you've got some pressure on those oculomotor nerves.
What causes ACM?
A lot of times they think it's just a birth defect. Sometimes it just causes it to sag down further. Sometimes it can be trauma. So it's kind of one or the other. So at the end of the first treatment, the patient noted that she could see the author's face through her right eye, which was shocking, and she could even see her mom's face, who was sitting 10 feet across the room. She was then taken to see the Snellen chart, the eye chart, and was able to read 20/30 with her right eye. And then after her second visit, 2 days later, she could see 20/20 out of that eye. So this is, I mean, it's insane. I mean, this is serious, like, brain injury stuff going on, and chiropractic, I'm telling you, it can help. So here we go, visual recovery following chiropractic intervention. This was a case study of an elderly man who fell down, head trauma when he fell between two logs and hit his head. Yeah, I don't know what he was drinking that day. But so he had problems when he woke up and he couldn't see, he's totally blind. And he had been diagnosed with cataracts, which is the #1 cause of blindness in America. And as we talked about before, the cataracts is the lens when the proteins start to get all kind of clumped up in there, and that's why the spicy foods and the peppers are really important for that, because it's going to help with the circulation and make sure you're getting all the fluids that you need to make sure that the circulation is in there, because you don't want anything dry. You don't want the macula drying up in the back of the eye where it focuses, and you don't want the lens to dry out either. So this individual, he diagnosed that he had mild macular degeneration, bilateral slight optic atrophy, so just a breakdown of the optic nerve, and he was unable to respond to traditional vision tests. So what I love about this, because even the optometrists know, he was referred to a chiropractor, because he's like, you know, I don't think I can help him. We need to get some pressure off those nerves and help him to see better. And so this is my interpretation of what he probably looked like. Except he would have two big logs on either side of his head. But that would be bad. So following chiropractic treatment, he reported that he had vision improvement and began following after his third adjustment. He reported that he was able to read better, et cetera, et cetera, et cetera. Following the improvements, the patient began to distinctly see actual light coming through a window. So instead of just black and then blue swirly lights and then yellow, he actually could see light coming through the window. So he was totally blind, and then after 3 adjustments, he was able to see again. So by eliminating the innervational intervention, aka nerve pressure, caused by the cervical soft tissue trauma to the head, so the inflammation had put pressure on those nerves, the optic nerve blood supply could have returned to normal after its previous constriction caused by the head trauma. So all you have to do is eliminate the nerve pressure, aka with a chiropractic adjustment, and there you go. Now this is an individual that received an upper cervical specific chiropractic adjustment, and when we do that, that's when we do the toggle recoil when you're on your side and the headpiece drops down. That's focusing on the top bone in the neck. So this was a study done on 67 subjects who had not previously ever gone to a chiropractor. They ranged in age from 9 to 79 years, averaging 46.4 years. They were evaluated for each eye before and 6 weeks after receiving the chiropractic care relative to their ability to accurately identify letters in a standard Snellen chart. That's the eye chart again. Sorry there's so many words on these slides, but it's just research stuff. The study suggests that upper cervical specific at C1 or C2 chiropractic care caused a differential improvement in the visual acuity of both eyes, as measured as a percentage change in vision acuity before and 6 weeks after chiropractic care. Through upper cervical chiropractic adjustment procedures employed within the current study, vision acuity improvements appear to be linked to the correction of vertebral subluxation. I couldn't even believe they used that in a research, that word. That's amazing. And chiropractic methods of upper cervical specific care. So, I mean, we're making progress because they're doing the research and we're finding out exactly, you know, what's causing the issues, and it's the subluxation, but they don't want to talk about it because it's the secret chiropractic word. But it's pressure on the nervous system that's killing people, and we got to really correct that. So it's like the secret handshake, secret word. So vision, the cervical spine, and chiropractic. So now this one makes important note that though chiropractic is not a treatment for esophoria, which is a condition where you have one eye that goes in, but it's not cross-eyed, it's not diplopia, or it's not seeing double, but one eye goes in because of an extraocular muscle imbalance, or blindness, or scotoma. This is a really cool, scotoma is when you're looking, everything looks normal, and there'll be like one little section of where you're seeing, of your visual field, that looks like it's all moving and like funky looking. So it's like a circus mirror, but just in one little section. So that's a scotoma. The correction of vertebral subluxation provides patients with benefits such as visual improvements that are not directly linked with their musculoskeletal complaints. So we're not just low back doctors, we already know that here in this office, but we can help in a variety of ways. Ultimately, even non-specific chiropractic interventions have the potential to bring about favorable results with regards to visual issues. Now this next one is my favorite. 114 cases, 83% of them saw improvement after a chiropractic adjustment. So we're getting into some bigger numbers now. Out of the 54 of the cases that the researchers followed up on for a minimum of 6 months, 95% of those still had that correction in their visual issues because of the chiropractic adjustments. And
Adjustment?
no, it's a series of adjustments. So also contained within this report were cases of vision that was returned to blind eyes, like the guy before that got hit in the head. So I'm not saying that we cure blindness. All I'm saying is that chiropractic adjustments take the pressure off the nerves and allow the body to do what it's supposed to do and to heal itself. So vision is your neurological window. Now this article briefly discussed that the spinal nerves play a very important role in vision because the nerves from the cervical spine, which is in the neck obviously, and upper thoracic spine in the upper back help to dilate, widen the pupil, and the opening, which is the opening that allows light in to the eye. These spinal nerves also make distance vision possible by helping change the shape of the lens, because if you're looking up close, the lens has to be a certain thickness, and then when you're looking away, it has to, the little ciliary muscles that are controlled by that optic nerve that go there, or actually, nope, that's the oculomotor nerve. They have to be able to change the tension on the lens to change the thickness to be able to focus in the distance. And so this is talking about how that's really important, and you have to control the blood vessels that supply the brain and the eyes as well. Chiropractic treatment, when it focuses on correcting misalignments or fixations, which is subluxation, in the upper thoracic spine and cervical spine, which can disturb the same spine nerves that affect vision. It argues that chiropractic adjustments to correct subluxations can help alleviate the related visual disturbances, which makes sense. It's reported that even some people with 20/20 vision at their first visit can get even better vision after 2 weeks of chiropractic care. So even if you don't have a vision problem, necessarily you see fine, people start noticing. We have people that have noticed vision changes. We also have people that have noticed that they've gotten their sense of smell back and they didn't realize they'd lost their sense of smell. Hopefully it wasn't because it was a bad smell, but they're actually able to smell better, which is just amazing. And it all makes sense when you see how we process vision. So the image comes in through the iris, hits the back of the eye on the retina, at the fovea centralis in the macular area. The optic nerve takes the image, takes it back to the visual cortex. Now obviously this isn't to scale because this would be way bigger, but it's just trying to focus on the eyeball right there. So like I said before, the visual cortex is in the back, and that's where, kind of like a camera, it processes the image and tells you what it is. So instead of just seeing a bunch of stuff, it like processes and tell you, okay, that's a dog, that's a little chihuahua named Peanut, or it's a palm tree or something like that. So it's all processed in the back of the brain, and so that's what we are. We're nervous system doctors. We work on the spinal cord and the brain itself when we do that cranial work, and that's what's so important here because it helps so much. So I have another question. We already know that. Now what does chiropractic do again? It removes the pressure on the spinal nerve. So it's obvious the connection between chiropractic and improving vision because it takes the pressure off the nerves that do the processing of the vision, and it's just, we're an office full of common sense people. That's just how it is. Now if you want to get even more studies, you can get the book here. It's on Amazon.com, and we also used to have copies here in the office. I don't know if we do still or not. Are there some there? Okay. And I've also, because like I said, I've started this a long time ago and I've really tried to put all this into an easy to understand format. There's 3 books, but I'm also in the process of coming up with the Clear Vision Construct is what I'm calling it. And that's going to be coming out hopefully next month. And it comes with all this different stuff. You got all 3 books. I'm working on the formulation for a supplement to make sure you get all the nutrients that you need to make sure you have the best vision ever. It's going to have video trainings. You'll also, the first 1,000 people to sign up get a free download of the You Don't Need Your Glasses book. So that'll be, you can get access to it immediately. And that's going to be at relaxedtoclarity.com is the name of the website. And it's not available yet, but you can go there and add your email in and I'll notify you when it's all ready. Plus, the good thing is it's going to be a membership site, and members get a discount of up to 25% on everything on the site.